ECG overread service. Cardiovascular disease and stroke remain the leading causes of death in the Western world. ECG is a routine investigation that helps to detect coronary artery disease, advanced blood pressure, cardiomyopathy, and many heart conditions. Stroke prevention may be possible by detecting atrial fibrillation on ECG. In fact, 32% of ECGs performed in GP surgery have an arrhythmia. Detecting and treating atrial fibrillation on ECG may help to reduce subsequent fatal and disabling strokes. Younger patients, especially sports people who have concerns about exercise-induced symptoms such as chest pain, dizziness, syncope, or concerns about sudden cardiac death, may benefit from having an ECG to detect rare causes of risk. ECG testing also helps to monitor drug therapy, including safety of antipsychotic drugs in patients with mental illness, or retroviral therapy in HIV patients, methadone treatment patients, cardiac drugs used for rhythm management, and several other drug treatments. An ECG may also benefit risk assessment in situations of symptomatic heart disease, family history of the same, higher risk patients such as smoking, obesity, diabetes, high cholesterol, family history, and in several medical conditions associated with heart disease, such as rheumatoid arthritis, depression, and peripheral vascular disease. Challenges with ECG. ECG testing is a very sensitive test for heart disease, but lacks specificity in all patients tested. There is a high false positive rate that translates into over 15% inappropriate hospital admissions. In many cases, this is due to poor quality tracings, incorrect lead positioning, incorrect patient preparation, technical faults with recording, and an overlap of medical conditions that create ECG abnormalities. Therefore, education and training of those who perform and read ECG is essential. Clinical trials, such as the SAFE study, have shown that this difficulty of interpreting ECG in the community leads to an increase in referral of patients to hospital where many might be avoided. In fact, this study goes so far as to suggest that a central reading service for ECG would clearly help. In cardiology practice, the current training requirement to read and interpret ECG is 500 ECGs and 100 per year to maintain competency. Formal training is undertaken in all cardiology training programs. For general practice, the turnover of GP trainees may limit access to enough ECG reading experience. Similarly, knowledge to read an ECG may diminish with time without up-to-date training and education. A solution to these dilemmas is an ECG overread service in the community provided by a consultant cardiologist. This provides value to the GP, the patient, and to the cardiologist. For the GP, ECG interpretation can be very difficult. An overread by a cardiologist means a more accurate diagnosis of ECG. This leads to greater patient and doctor satisfaction, less need of referring patient to hospital, and more decision-making can take place at primary care level. This creates reassurance, confidence, and costs less. Clinical evidence shows that GPs fail to detect atrial fibrillation on ECG in over 20% of cases. An ECG overread service provides 98% detection. In the same study, up to 40% of MIs may also be missed on ECG. Our own pilot study of 74 consecutive patients from 3 GP practices showed that an ECG overread by a cardiologist reduced the need for patient referral to the hospital or clinic in over 50% of cases. In the same study, over 50% of ECGs were abnormal. For the patient, access to cardiology services in Ireland can take several weeks of waiting and usually costs more to arrange privately. An ECG overread service helps the GP to confidently assess and interpret the cardiology problem, and usually there is significantly less need for the patients to be referred to hospital. The reduction of referrals improves access to cardiology hospital services for those patients who need it most. For the cardiologist, A close relationship between GP and cardiologist is good for patients, GPs and the cardiologist. It allows for direct communication between GP and cardiologist, which helps to improve cardiology decision-making in primary care. It also helps to prioritise access to cardiology for patients who have the greatest need. Clinical trials have shown that 10 to 15% of patients referred to a cardiologist for an abnormal ECG do not have an abnormal ECG and may not require referral. Connected Diagnostics. Connected Diagnostics is an Irish company co-founded by myself and colleagues to provide telemedicine-based health services in the community, including ECG and Holter monitor overread capability. This is made possible by cloud computing technology. We have put together an online training module to help you get started with better ECG testing. Once this is completed, you can register your practice and avail of our ECG and Holter overread services. Further information and contact details are available from our webpage, connecteddiagnostics.com.